Guys, so today's topic is cough. We are going to diagnose the cause of cough. There are various causes of cough, some serious and some normal and common causes of cough. It can be difficult sometimes to reach towards diagnosis. To ease our approach, we are going to follow the diagnostic model which follows on number one, we have probable diagnosis. In probable diagnosis, whenever the patient comes to you with cough, the number one diagnosis and the very common diagnosis we can make and we can suspect differential diagnosis can be upper respiratory tract infections, and it is the most common cause of cough usually. Then we have, and it is usually the most common cause of cough. Then we have rhinitis and sinusitis. Smoking can also be the cause. If you are smoking, and another cause can be if someone around you is smoking and the environment has smoke and some chemicals, so you can also get cough due to that. And then we have bronchitis and COPD. Some serious disorders which should not be missed, which can lead to some lethal outcomes and mortality, include number one, we have cardiovascular disease. In cardiovascular disease, which patient can get cough when the patient has left ventricular failure, due to which he has pulmonary edema. So the patient can cause cough in later stages, and the cough would be dry cough. Then we have neoplasia. Lung cancer is also a very serious cause of cough, and the cough would be progressive and worsening in nature. Infections. In infections, the patient can present with cough in pneumonia, TB, influenza, HIV, and COVID infections. Then we have the asthma and the cystic fibrosis, foreign body, especially in young children, in toddlers and children. And then if there is an acute complaint of SOB and cough, the patient, we can suspect pneumothorax. The pitfalls are the ones, are the disorders which often get missed and ignored. Number one, we have atypical pneumonia because the features are very atypical and non-specific in comparison with typical pneumonia. The patient has, in comparison to typical pneumonia, which have classical symptoms, but the atypical pneumonia have non-specific symptoms, and symptoms can be systematic. Symptoms can be systematic. Then we have gastroesophageal reflux disease, especially if the patient is complaining of cough at night and on lying down. Bronchiectasis can be one of the disorders which often get missed. Obstructive sleep apnea, especially in obese patients. Whooping cough in children, and interstitial lung diseases, sarcoidosis. Asthma can also be a disorder which gets missed sometimes when the classical wheeze is not present. And then we are going to do the muscarads. In seven muscarads, what can be the cause of cough? There can be drugs like ACE inhibitors and bleomycin, which causes pulmonary fibrosis, can also be the cause of cough. Beta blocker, sulfasalazine. Among the seven masquerades, the drugs can be one of the causes. Then we have patient is trying to tell me something. If the patient has anxiety and habitual, is some patients like to clear their throat as with the help of cough when they are going to give some speech or when they are speaking. We have to take history very carefully. Then we have red flags, which should not be missed, and we have to search and look for these red flags in every patient who is coming with cough. Especially if the patient is coming with cough, onset of cough, and he is more than of 50 years old, and he has a smoking history and asbestos exposure history. The patient is complaining of persistent cough. The patient has a history of overseas travel, which in overseas travel we can suspect the infections. Then TB exposure. If a patient has a TB exposure, he can again exposed to TB. He has a history of he's complaining of hemoptysis, weight loss, and dyspnea and fever. These are the red flags. which should not be missed in every patient who is coming with cough. Moving forward, we have some diagnostic characters of every cough, and underlying every disorder has a kind of different cough. For example, if patient and especially the child has barking or croup like cough and the stridor is present there, it can be due to croup and laryngitis. If the cough is bovine, bovine cough is the one which has no power and very weak cough. It can be due to vocal cord paralysis. Paroxysmal episodic cough with whoops, it can be in whooping cough. If the cough is painful, it is due to tracheitis. It is usually in tracheitis, and dry and chronic cough is commonly associated with GERD and gastroesophageal reflux disease and drugs. If the patient is complaining of the cough at night, especially nocturnal, which is nocturnal, it can be due to asthma, and other nocturnal cough and other night symptoms. The patient can have asthma, gastroesophageal reflux disease, left ventricular failure. Why in left ventricular failure? Because if the patient is lying down and he has pulmonary edema, on lying down um, he will complain of shortness of breath, which is called as orthopnea. And if the patient sits, the fluid in the pleural edema and lungs settles down in the lungs, and the patient improves his breathing. But on lying down, left ventricular failure, the fluid spreads in all over the lungs, and the patient complains of shortness of breath and left ventricular failure. And he can also complain of a nocturnal cough, which is dry but in later stages. Then on in postnasal drip, in chronic sinusitis. If the cough is associated with changing posture, it is it can be associated with bronchiectasis and abscess in pulmonary abscess. If the cough is associated with meals, it can be due to hiatal hernia or esophageal diverticuli, tracheoesophageal fistula. Cough is associated with wheezing. It is a classical symptom of asthma. If the breathlessness is there along with cough, there can be asthma, left ventricular failure, and COPD. And if the patient is complaining of acute breathlessness, pneumothorax can also be one of the causes. The productive cough, which has productive cough. So productive cough is the one which has a sputum in it, and there can be many causes of productive cough: pneumonia, infectious diseases, and pulmonary abscess, TB. These are some of the causes of productive cough. And there are certain characters of sputums which aid in our diagnosis. For example, if the sputum is rusty, it can be due to lobar pneumonia. And if the sputum is profuse watery, it can be an alveolar cell carcinoma. Red currant jelly sputum is seen in bronchial carcinoma. If the sputum is offensive and it is profuse, it is usually a characteristic of bronchiectasis, and offensive sputum can be a cause of abscess. Can be due to abscess. And if they are thick plug-like mucus sputum, it can be in allergic bronchopulmonary aspergillosis. And pink frothy sputum is usually seen in pulmonary edema and left heart failure. So, what can be the cause of cough if we see in certain ages? In infants, it is usually in tracheoesophageal fistula and reflux disease and bronchiolitis. In toddlers, the foreign body inhalation, asthma, whooping cough, cystic fibrosis, and croup. In older children, asthma, bronchitis. In older children, asthma, bronchitis, and smoke exposure. And in adults, we have discussed later, all the other causes of cough can be seen in adults. So, if we see solitary pulmonary nodule, solitary pulmonary nodule on chest X-ray, it it refers to bronchial carcinoma. There are certain, if we see a solitary pulmonary nodule in chest X-ray, it can be due to bronchial carcinoma. Secondary tumor can also be there. Solitary metastasis, granulomas in TB, hematoma. These can be the differential diagnosis of solitary pulmonary nodule if we see on chest X-ray. In lung cancer can be of two types. One is non-small cell lung carcinoma, and other is a small cell lung carcinoma. A small cell lung carcinoma is also referred as oatmeal cancer and poorly differentiated cancer. It is this is a very bad cancer, and it has a worst outcome. Surgery is not indicated because it metastasizes so rapidly, and chemotherapy is only when there is life expectancy more than few months. If life expectancy is more than few months, chemotherapy can be considered. In non-small cell cancer, it can be of three types: squamous cell carcinoma, adenocarcinoma, large cell carcinoma. Surgery can be done in non-small cell lung carcinoma. Curative resection in patients who can benefit from it, and chemotherapy has also a good prognosis in non-small cell lung carcinoma. But a small cell lung carcinoma is very lethal, and it metastasizes very rapidly. The surgery cannot be done, and chemotherapy is can be done when only life expectancy is more than few months. Then we have mesothelioma. Mesothelioma is suspected if a patient has asbestos exposure and he has chest pain, dyspnea, weight loss, and recurrent pleural effusion. He is complaining of recurrent pleural effusions. So we can consider mesothelioma. Then a very difficult diagnosis, which is bronchiectasis. Bronchiectasis is usually dilatation of bronchi after irreversible damage of their walls after any infection, repeated infections. Risk factors, what can be the risk factor if there is foreign body inhalation, and foreign body inhalation, history of TB, cystic fibrosis, cartilaginosis syndrome, and repeated infections can be the predisposing factors for bronchiectasis. These disorders can predispose a patient to bronchiectasis. Uh, a, a symptom which can be there in bronchiectasis is chronic cough after waking up, and purulent offensive profuse sputum, persistent halitosis, recurrent febrile illnesses, weight loss, pneumonia, pneumonia, and the sputum is associated with posture. On examination, clubbing would be there, and the pathogens which predispose to infections can be Haemophilus influenzae. So when we are going to, what are the points when we see and we have to refer the patient to a specialist? These are when the patient needs bronchoscopy to exclude carcinoma, and there is persistent hoarseness, which there is persistent hoarseness which requires laryngeal examination to see if the recurrent to see the cause of hoarseness, which can be the um, suppression of recurrent laryngeal nerve due to any mass, and pulmonary TB is there. These are the points when we are going to refer the patients. Thank you. That's it for today.